In this video, we will talk about utility management, which is the last section in the facility management and safety chapter. For more videos, visit my Facebook page, Healthcare Quality. Utility can be defined as the systems and equipment that support essential services inside the hospital. Such systems include electrical distribution, water, ventilation and airflow, medical gases, plumbing, heating, waste and communication, and data systems. Patient care, both routine and urgent, is provided on a 24-hour, 7 days in any hospital. Thus, an uninterrupted source of essential utilities is critical to meeting patient care needs. The safe, effective, and efficient operation of utility and other key systems in the hospital are also essential for patient, family, staff, and visitor safety. The hospital should establish and implement a program to ensure that all utility systems operate effectively and efficiently. Hospitals should have a complete inventory of all utility system components and identify which components have the greatest impact on life support, infection control, environmental support, and communication. The utility management program includes strategies for utility maintenance that ensure that these key system components are regularly inspected, maintained, and when necessary, improved. Clean and healthy air is one of the basic requirements of hospitals. HVAC is heating, ventilation, air conditioning, and refrigeration systems. The main responsibility of HVAC section is to provide service facilities to patients and every department's requirements. Some critical areas of a hospital complex, like operating theaters, intensive care unit, delivery room, newborn, open heart operating rooms, and minor procedure rooms, are equipped with HEPA filters to control the bacterial growth. These filters are checked on monthly basis. Let us talk in detail about water supply, sewage systems, and power supply. An uninterrupted source of clean water and electrical power is essential to meet patient care needs. Water quality could be changed suddenly from many causes, some of which occur outside the hospital, such as a break in the supply line to the hospital. A good utility management program ensures the reliability of the utility systems and minimizes the potential risks. For example, waste contamination in food preparation areas, inadequate ventilation in the clinical laboratory, oxygen cylinders that are not secured when stored, leaking oxygen lines, and frayed electrical lines. All pose hazards. To avoid these and other hazards, the hospital has a process for regularly inspecting such systems and performing preventive and routine maintenance. During testing, attention is paid to the critical components, for example switches and relays of systems. Designated individuals or authorities monitor water quality regularly. The testing can be carried out by individuals designated by the hospital, such as staff from the clinical laboratory, or by public health or water control authorities outside the hospital, judged competent to perform such tests. Whether performed by qualified hospital staff or by authorities outside the hospital, it is the responsibility of the hospital to ensure that the testing is completed and documented. In addition to testing water quality to prevent and reduce risks of contamination and growth of bacteria, the hospital implements measures and routinely inspects and monitor the measures for their effectiveness. Quality of potable water is tested at least quarterly, and testing of non-potable water is performed at least every 6 months. Testing is conducted more frequently for potable and or non-potable water if required by local laws and regulations, if indicated by the conditions of the sources for water, and or if there was previous experience with water quality problems. Some conditions of the sources of power and water that may increase the frequency of testing include repeated repair of the water system, frequent contamination of the water source, unreliable electrical grids, and recurrent unpredictable power outages. Improvements are made when necessary, such as enhancing electrical services to areas with new medical equipment. The Hospital Utility Systems Program ensures that potable water and electrical power are available at all times and establishes and implements alternative sources of water and power during system disruption, contamination, or failure. Regardless of the type of system and the level of its resources, a hospital needs to protect patients and staff in these emergencies. When there is disruption in the usual source of water supplies to the organization, emergency potable water supplies must be immediately available. The hospital tests its emergency water and electrical systems and documents the results. Water quality is also a critical factor in clinical care processes such as renal dialysis. Water used in renal dialysis is tested monthly for bacterial growth and endotoxins, and tested annually for chemical contaminants. Thus, the hospital established a process to monitor water quality and implements actions when water quality is found to be unsafe. An emergency power system is required for all hospitals that intend to provide continuous services under emergency conditions. Such a system provides sufficient power to maintain essential functions during power failures. It also reduces the risks associated with such failures. Emergency and backup power sources are tested under planned circumstances that simulate actual load requirements. For example, for quarterly testing, the test run for 30 minutes and should achieve 30% of the nameplate load. The 30-minute time frame doesn't include the time it takes for the warm-up or cool-down periods. Hospitals may choose other methods for testing that meet industry standards. When the emergency power system requires a fuel source, the amount of on-site fuel stored should take into account past outages and any unanticipated delivery problems caused by shortages, weather, and geographic conditions and locations. The hospital may determine the amount of fuel stored unless an authority having jurisdiction specifies the amount. We defined the major steps each hospital should do to prepare for such emergencies. First, identifies the equipment system and the locations that pose the highest risk to patients and staff. Then, assess and minimize the risks of utility system failures in these areas. And plans emergency power and clean water sources for these areas and needs. Test the availability and reliability of emergency sources of power and water. Document the results of tests and ensure that the testing of alternative sources of water and electricity occurs at least quarterly or more frequently if required. Thank you.